Canadians have watched in horror as the COVID-19 death toll climbed in Canada's long-term care facilities, now over 6,000. In Australia, just 29 people. Greg Shaw, who runs the International Federation on Aging, is uniquely positioned to compare the two countries.
The building standards are very different in Australia.
He lives in Toronto, but previously served in senior roles in Australia's health ministry. He says that to start with, Australia's aged care facilities had a detailed plan to deal with the pandemic, while Canada did not.
When COVID-19 was known and came into Australia, many of the care providers basically locked their homes down and implemented their pandemic plan for infection control. So they stopped families from coming in. They didn't have staff working from one facility to another facility, and generally that's not the case in Australia anyway.
One of the most striking differences between Canada and Australia lies in the inspection regime for senior facilities. Australia is much more strict. Graham Pryor runs one of the largest for-profit aged care providers in Australia. He owns dozens of homes and says the inspections of them are rigorous.
If we get a report from the federal authorities in 6 months' time from an inspection, and it's a negative one, we've got 28 days to fix it. There's no mucking around. There's no I'll think about it. So we'd be sanctioned and we'd be out of business in 6 months.
12 homes were shut down in Australia in 2018, 0 in Ontario. None again last year. Tamara Daly of York University is a senior care expert.
We don't seem to have the kind of teeth that they've given to their inspectors, and we don't act as readily to shut a home down. So they remove accreditation really fast, and as a result of that, I think that they are getting better compliance with their standards.
Government spending on senior care is about the same in Canada and Australia, but they seem to get more for their money. As of 2015, all senior homes in Australia have private rooms for singles or semi-private for 2 people sharing.
Basically, no more than 2 people per room with their own ensuite. In terms of toilets and showers, it's no more than 6 residents in an older home for 1 shower and toilet.
In Canada, 38% of homes have rooms for 4 residents, a factor that worsened the spread of COVID-19. Canadian personal support workers often have to care for up to 36 residents. That leads to a big difference in the two countries' approach to patient bathing. If I wanted to put my mother in one of your homes and said, look, I'd like her to have a bath every day, could I make that request? Would it be fulfilled?
Well, of course you can. You'd be looked at, like I'm looking at it right now, quite quizzically. Everyone gets a bath every day. I mean, that's the way it works.
What about in Ontario? Would that happen in Ontario?
In Ontario, no. No. You are entitled to 2 bath times each week.
Many trace the drop in Ontario's senior care staffing levels back to the 1990s, when Conservative Mike Harris was Premier. Harris actually budgeted an extra $1 billion for senior care in Ontario, but his government directed 60% of that money to private, for-profit providers, and he cut staffing requirements.
Mike Harris did, in fact, get rid of the minimum staffing level for all frontline staff. Cutting minimum staffing has had a very negative impact on the sector overall.
After he left politics, Mike Harris became the chairman of Chartwell Homes, one of Ontario's largest for-profit senior care providers. As you might expect, Chartwell has had staffing level issues. Consider this one Chartwell home in Kingsville, Ontario. Government inspection reports show that the home has been cited dozens of times in recent years for not maintaining adequate staffing. Follow-up inspections often found that the Chartwell operators repeatedly failed to comply with regulations, but there has been little consequence for them.
They're getting away with it because there aren't serious consequences. Tell me where in any province in Canada where the government said you're not meeting the standards and outcomes that you should be meeting, we're actually putting in an administrator to bring the care standards in the home and the service provision up to standard before we will allow you to take it over again. And you've got to be able to demonstrate to us that you're capable of running the nursing home.
Doesn't happen.
Doesn't happen.
As a result of the COVID-19 crisis, the Ontario government has announced it would finally take over 9 senior homes. None of them belong to Chartwell, which does not have the worst death record among providers. A crucial tool to find major problems is for inspectors to arrive without warning. In Australia, recent records show 3,099 unannounced inspections in 1 year. CBC News discovered that in Ontario last year, there were only 9 unannounced inspections. There are some stark examples in Canada of egregious behavior in senior care homes. In 2013, at the St. Joseph's facility in Peterborough, Ontario, Camille Perron noticed suspicious scratches and bruises on his 85-year-old mother, who suffered from dementia. After numerous complaints to facility management with no result, he placed a hidden camera at his mother's bedside, which recorded regular abuse from caregivers. 4 low-level public service workers were fired, but again, there was little consequence for the management.
In Australia, the system would have said there's a systemic issue in that home around treatment of its residents, and there would have had to be sanctions put on that home where they couldn't take any new residents, any new transfers, until such time as they're able to demonstrate that they had a training program to mitigate abuse in that home for future.
Of the 6 worst-hit seniors' homes in Ontario where the Canadian government was dispatched to help out, 5 were for-profit homes.
We know, even before COVID happened, that nonprofit and public homes pour money in and have higher staffing levels, as well as better workplace protections. So they have more permanent staff, they have more staff that have benefits.
In Canada, the cost of senior care varies a lot depending on the province, whether it's public or private, urban or rural. Greg Shaw thinks that is a big argument to have a federally regulated and controlled senior care system, as they have in Australia.
It doesn't matter where you live in Australia, you can access the same level of service at the same cost and the same care provision with the same measurable outcomes, irrespective of where you live. A national system certainly works well in the Australian context.
In Ontario, a great deal of the money spent on senior care ends up in executive compensation and shareholder dividends for the private providers. The Toronto Star reports that for Mike Harris's Chartwell Corporation, that figure was $845 million over the last 10 years. At the end of last year, he personally had a $7 million stake in the company.
We also do have quite a bit of profit taking in this sector, and so we need to ask really, really clear questions about how we want public dollars used and what we need to demand.
Ontario Premier Doug Ford has pledged to completely rethink senior care in his province, but he will face a determined campaign by the for-profit sector to guard its stake in the existing system. He admits that he already received a call from former Premier Mike Harris since the pandemic outbreak.
I had, I think, one call in the last 6 weeks from former Premier Harris to ask how he was doing, and to be frank, I didn't even know he was the chair of Chartwell.
Mike Harris at Chartwell Homes has just hired his former Ontario Conservative campaign manager, Leslie Noble, to lobby the Ford government on this file. Doug Ford will also be lobbied by his own former campaign spokesperson, Melissa Lantzman, and his former marketing director, Lauren McDonald, who both have just been hired as lobbyists by other for-profit providers. A few weeks ago, Justin Trudeau speculated aloud about how the federal government should get more involved in senior care. He was quickly shot down by Quebec Premier François Legault, who basically suggested that the federal government should mind its own business and stay in its own jurisdiction. The politics of this situation have pushed Trudeau to back down, because at the moment the senior care homes are seen as a terrible problem that tarnishes any politician responsible for the mess there. There is some question as to whether the COVID-19 disaster in long-term care facilities will change that political calculation because the public might demand change. Terence McKenna, CBC News, Toronto.